Now, when you bring the data into OMOP, what comes across? And I just want to give you one example of a situation where it's challenging. So Emily is 54 years old and goes to her GP, who observes in the clinic that her blood pressure 158/92 is raised. But Emily has actually been capturing her blood pressure at home. And when the GP looks at the blood pressure readings at home, his conclusion is that the blood pressure is really elevated in the clinic only, but not at home. And we have a phrase called white coat hypertension. In other words, you're nervous when you see a clinician, your blood pressure goes up. It's not representative of your real blood pressure. And the GP decides to reduce the blood pressure treatment, not increase it, because it is his belief that the blood pressure is fine. Now, when you bring the data into OMOP, what comes across? The observed blood pressure comes across, because that's what's stored in the EHR, and the new dose of the drug is captured. Not the home measurements, not the clinical thinking. So it would appear to somebody looking at the data that the dose has been changed out of keeping with the observed blood pressure. So Emily would be miscalculated as having uncontrolled hypertension. So that's an example of where we need to be really careful when we move data between representations, that we might lose some of the context, some of the richness, and we risk misinterpretation.